Hello and welcome to the Outpatient Behavioral Health Policy Pisces in the Portal presentation. Our class description today is we will review the Sooner Care Outpatient Behavioral Health Program. It will include an overview of commonly asked questions by behavioral health provider type, as well as reviewing recent changes in policy. We will also give a tutorial of submitting a CDC or a PA in the Pisces system. We will also cover eligibility, treatment history, view authorization status, and claim submission for outpatient behavioral health on the provider portal. This class is a how-to class and will not cover any clinical information. Our agenda today, we will go over some new things in policy. We will talk about eligible members. We're going to go over the coverage for the different behavioral health provider types. We will cover FAQs for the different provider types. We're going to discuss Pisces and the provider portal. And then once we get to the portal, we're going to go over how to submit a claim. And we will not leave you alone. We will give you plenty of resources. So the first thing we're going to do is we're going to talk about what's new in policy. First thing is there is a new fee schedule for agencies. This went out last September. That would have been September of 2019. It is out available on the public site. For groups and individual providers, there's a new fee schedule that went into effect in January. Also, for claim submission, effective immediately, we want all claims submitted either electronically through EDI or via the provider portal. And if you do need to submit an attachment for your claim, we really need it to be uploaded and not faxed. So what's new? Case management units change from 16 units per member per year to 12 units per member per month. This went into effect September 1st of 2019. Also, you are no longer using the GD modifier on behavioral health case management claims. Also, under supervision contracts expired on May 31st. So if you've got somebody within your agency that did not get their contract renewed, they will have to do a brand new contract. And keep in mind, these under supervision contracts are good for 1 year. If someone is no longer under supervision and they're now licensed, they will need to do a brand new contract and get one as a licensed behavioral health professional. Also new, effective on September 1st of 2019, big change, soon to be Sooners members now have the full scope of outpatient behavioral health benefits through mental health and substance abuse. This is what the eligibility looks like when you're checking eligibility on a soon to be Sooner. Another big change is the member address updates. When checking eligibility, you may see a little red note at the top that says, please have the member contact the Sooner Care Helpline. If it gets to this point, what happened is we have received multiple pieces of mail as return mail for this member. And if we cannot reach out to the member, they are possibly going to lose their eligibility. If they don't update, they can call into the Sooner Care Helpline. They can also go to mysoonercare.org. It's their own little website, kind of like the provider portal where they can update. If they are current, they won't have to worry about this, but we do get tons of mail back. So we do want to make sure that you, the provider, know about this. You can actually go out onto the public site and get a copy of this flyer to post in your office. Another thing that's new out there is we have applied behavioral analysis. This is actually an exact copy of a global message that went out on the public site for behavioral health providers. If you are not signed up for web alerts, I highly suggest you get them and you request that anytime that there's an update to anything behavioral health, you get it. Otherwise, you can go out to the public site. Under provider, there is a tab that says updates and then global messages, and you can go out and see what's going on with the applied behavioral analysis. Another change is that we have now opened up telehealth for providers to bill during the COVID-19 pandemic, and the Healthcare Authority has extended billing telehealth through September 30th of 2020. There are a couple of other global messages here as well that tell you about what you as a behavioral health provider can do, and gives you a link to go find information on billing for that. Now we're going to talk about eligible members. And OHCA administers 2 health programs. We have Sooner Care or Medicaid, and we have Insure Oklahoma. Both are forms of health care coverage for our members. Insure Oklahoma is for those who don't qualify for Sooner Care, but meet specific eligibility guidelines to provide coverage to them and their family. So the first one is what it looks like when they have Title 19. If the member has Insure Oklahoma, it looks like Public Product OEPIC, and these are examples of screenshots of what it looks like for those 2 types of eligibility. If a member only has mental health and substance abuse showing when checking eligibility, that member must be seen at an ODMH SAS contracted provider. And keep in mind, when you see mental health and substance abuse, this is not a guarantee of the benefit, but it's a placeholder that says this member might be eligible for services from a DMH contracted provider, and that provider will assess their eligibility, both clinical and financial. OHCA is the single state agency that administers the Medicaid program, and the Department of Mental Health and Substance Abuse sets all the rates and policy for the outpatient behavioral health program. So you know a little bit about the team players. Going on with eligible members, if a member has Title 19, Insure Oklahoma, if they're enrolled via the breast and cervical cancer program, they have access to outpatient behavioral health programs and coverage. And if it's mental health and substance abuse, just keep in mind that they have to see a DMH contracted provider for the MHSAS. Members who do not have coverage are when they're enrolled via Sooner Plan or the Family Planning Program. So now we're going to talk about the types of behavioral health providers. We have agencies, including MDs. We have LBHPs, including licensure candidates under supervision, paraprofessionals. And for DMH providers, we have peer recovery support specialists, family support specialists, and behavioral health aides. We have private LBHPs and psychologists. We have behavioral health groups and physicians. And if you're going to bill as an individual, you need to make sure that you get set up as a yes biller. Or if you're an individual or psychologist, you can be tied to a group or a clinic where the group does the billing and the individual provider is listed as the rendering provider on those claims. This shows you what members can be seen by the different provider types. So you'll notice that agencies can see adults, they can see kiddos, they can see the Insure Oklahoma adults and kiddos. If I am a private LBHP, I can see kids 20 and younger. I can see the Insure Oklahoma adults and kids. Same with the behavioral health group. And then physicians can see all ages. So it's very important. And probably the hardest thing that we run into are when a provider has been in an agent setting and they go into the group or clinic or individual setting, they don't realize that you can only see kids under that. So it's very important to know who you can see based on the type of contract you have with the Oklahoma Healthcare Authority. And as you can see on this list, the agency providers can render many more services than the private LBHP or the behavioral health groups can. We've got screenings and referrals, assessments, psychotherapies. There are a lot of things that can be done through the agency that the private LBHP or the behavioral health group cannot. So you just need to know what services based on your provider type and how you're contracted so you know what services you can render. Now we're going to go over some FAQs. We're going to start with agencies. And the first question is, can I get paid for screening? And the answer to that is yes. Screening is payable for members who are seeking services for the first time with an agency. The screening tools used must be evidence-based. We're giving you the policy here for a reference. And LBHPs, licensure candidates, and paraprofessionals are approved staff to render these screenings. How much time do I need to spend completing the assessment, and what is an event? The minimum time has been removed, which allows you, the provider, greater flexibility. And there is no time associated with the assessment. And now there is only one billing code, and we're giving you that code here. This is directly from the fee schedule off of the public website. What is the process for adding a new clinician to a case? A complete service plan modification with the new clinician goals and objectives is required. The behavioral health service plan development moderate complexity is limited to 1 per member per provider unless more than 1 year has passed between services. And for the low complexity, the service plan updates are required every 6 months during active treatment. Does the behavioral health case manager need to sign the treatment plan? And the answer for this is yes, yes, yes. There's a lot of policy here that you can go through and read, but just know it is important. You must sign it, and just read through this and make sure that you understand how it works. But the answer to this question, yes. Can I bill 1 hour of psychotherapy per week? The weekly limits run from Sunday to Saturday, regardless of the month or holidays. The weekly limit for individual, family, and group therapy are separate. For example, a member may receive up to 8 units of individual and family and up to 12 units of group in a week. And the big thing to note on this is the limits are based on the member, not the agency. The next question, can I bill 1 hour of psychotherapy per week? For individual or family therapy, there are multiple ways the limits can be used. Family therapy and individual therapy can be billed on the same day, but neither can exceed 4 units in a day or 8 units in a week. And then we've given you some examples for you to fall back on if you have any questions, so you can go through these and say, okay, well, I've done this, can't do this. So there's some good examples for you. My therapy claim is denying. If we have a letter of collaboration with another agency, how do we know when they build psychotherapy units on the member? And this is very important. That you can go through Pisces on the CDC system. When a provider secures a PA, you can see what units have been available. And then we also have treatment history, and a lot of providers don't realize what treatment history is, so we're going to go over that a little bit. This allows you to see if a claim has been submitted and paid to another Sooner Care contracted provider for the same service. Treatment history is a role, so if you're logging on to the provider as a clerk, you will need to make sure that they give you that role. So what we've done here is we've logged on to the portal, and we're giving you an example. We went to treatment history. It is under the eligibility verification tab. We're choosing medical. We're going to put in the member's ID. We're going to put in a date span, and we're going to choose, in our case here, we choose the HCPCS code, and we're going to put a procedure code in. We hit search. If we get results back, these results are for paid claims to a Sooner Care contracted provider. We don't give you any other information than that, but in our example here, we can see that in our date span that we did a request on, there were 2 different claims paid, one for 1 unit, one for 4 units. And once again, I can't stress enough, if you are logging on to the portal as a clerk, you need to make sure you get the agency, or you get access to this. Another thing we want to talk about is, and here's an example of a member who is enrolled in a health home. They are enrolled with Scissortail Behavioral Health. And what we want to make sure you understand is that the health home is a state plan option that coordinates general and behavioral health care. You're integrating mental health, substance abuse, and primary care services. The health home provider is responsible for meeting all of the members' behavioral health needs. They receive a large monthly care coordination payment for services. So as a result of this, CMS will not allow the healthcare authority to make payments to other providers for certain services when the member is enrolled in a health home, as CMS finds these payments as a duplicate. That's why there are so many services that are non-payable to members enrolled in health homes. And once again, this is what it looks like when you are checking eligibility. We always want you to stress that you do the expand all so that you can see when they do have a health home, and this is what it looks like. These services are the only services that are payable to the member's health home. So you need to know what is payable to the health home and what you as a provider can bill for. So it is so important. Once again, I can't stress enough. Make sure when you check eligibility on those members that you are hitting expand all so that you can find out for sure if they are enrolled in a health home or if they just have Sooner Care benefits. So now we're going to move over and we're going to switch gears and we're going to talk to the LBHP or behavioral health groups and go over a few things for them. There are a few limitations, and here are a few of them. Time codes are 1 per day. An event code can have 1 on the same day as a timed event. So we look and we see that we give you the code and we give you the time. So on the left-hand side are the timed psychotherapy codes. On the right-hand side are the events. So you need to know exactly what it is you're billing. So we have the same question that we had earlier. My claim is denying. How can I see if the member is being seen by another provider? Once again, treatment history is a wonderful tool that you need to be able to access. So you'll go out there to treatment history, and we're going to go and look at an example for a behavioral health, an LBHP or a behavioral health group. Once again, this is a role. So if you're logging on as a clerk, make sure they're giving you access to treatment history. Treatment history is under the eligibility tab when you're on the portal. We're going to choose medical. We're going to put our member ID in. We're putting our date of service and our codes, and we come back and we see that during the date span that this member had 4 claims billed by a provider. So if those claims are not yours, that means this member was being seen by another provider. And once again, just keep in mind that when you do get a result, these are for paid claims to a Sooner Care contracted provider. And just on a side note, the 90791, the assessment, and H2011 crisis intervention do not count as one of your 4 units that you get per month. So now then, we're going to talk a little bit about Pisces and the provider portal. And just keep in mind, we're not going to go into a whole lot on Pisces, but we just wanted to go over a few things. And this is a screenshot directly from the behavioral health page on the public site. So if you go to www.okhca.org, under the provider tab, it says types. Then the very first link is behavioral health, and all the information you need you can get off of this page. It's got contact information. It's got all the forms. So there is a lot of information out there for you. So now we're going to talk about CDC. This is what the paper form looks like. Many providers still fill out the paper version and then key directly from this form. Others just use Pisces. It depends on whether the clinician is submitting the request or maybe you have a delegate that's putting this in. But this form is available out on the DMH website, and we'll give you access to that website later on in the presentation. We're not going to go over all of these CDC types, but we wanted to make sure you know about all of them. The 21, the 23, and the 42 are the most common. Agencies submit the 21 and the 23 as well as the 42 if needed. LBHPs and groups submit the 23. There's a lot more information about the different types of CDCs that can be contained obtained on the DMH website. So you just know that these are a few of the options that you have. So if you have never been onto Pisces, you're going to need to go out and get an access to Pisces. We've given you the website to the DMH, the link to the DMH website. You'll go out there and you'll see CDC data entry system. You're going to follow this link to get to Pisces. This is the landing page when you're getting there. You'll notice the helpful numbers and emails on the right-hand side of the page. If you need help getting access to Pisces, maybe you already have it, but you do not know how to submit anything on the website, you can reach out through the email or the phone, and DMH will actually do a phone visit with you and get you set up and help you put in a CDC. So this is the page you'll use to create an access control account. This is not a Pisces account. The only way to create a Pisces account is to call or email and get into Pisces, and that was the phone number of the email on the previous slide. But once you have access, this is what it looks like when you get into Pisces. This is the home page. And keep in mind, we are not going to show you how to submit prior auths or CDCs on Pisces. We just wanted to make you familiar and give you access and show you how to get in there. But if you're actually wanting Pisces training, you'll need to reach out to DMH. If you're going to create a new CDC for a client who's never been seen by your agency, you're going to hit the Add New function. And like I said, this is about as far as we're going as far as submitting a CDC. We just wanted you to see the slides and be aware of what all you need access to so that you can get the assistance. I worked with some folks at the Department of Mental Health and Substance Abuse, and they sent me this list of the most common issues. And the client name, social security number, and date of birth on the member search. If it's incorrect, use the member ID correction form, and that's available out there for you. Linking ID numbers. Exception to this is the adoptions, but make sure you use the member ID correction form. What happens is we get members that have multiple IDs. We need to indate some of those and combine them so that they only have one Sooner Care ID number. The dates of the CDCs, especially on the 23 and the 42. Referrals. Another issue they run into is employment. And unemployed versus not in the labor force. And then employment always will override education. Other common CDC issues that are not addressed may be the CDC with a PA versus a CDC only, screenings, tobacco, level of care, service focus, and CAR score. So there are several things that could cause issues, but the folks at DMH will be able to help you with any of those problems. If the prior authorization has been submitted and successfully saved, you will see the PA information in the right-hand corner. And the main thing I want to point out is now we have a PA number. Another thing, when you are on Pisces, there are so many reports and things that are available to you out there. For example, you can see if your clinicians are working for other agencies. You can look up rehab eligibility reports. There are a ton of them out there, but you can go out and just kind of search around and find stuff, but there is a lot of information available out there for you. So I've submitted my CDC into Pisces, and it shows it accepted and it's approved. But now you're ready to bill. But once it's been approved in Pisces, it must show in the Oklahoma Healthcare Authority provider portal in prior authorization. So once it gets in there, then you're ready to bill. And the prior authorization approval dates are based on what you submit in Pisces. So your PAs aren't going to be approved for the 1st to the 30th of the month. If you submitted it and put a start date of June 26th, then it's approved. Your dates will be June 26th through July 25th, July 26th through August 25th. So it's so important that you know the dates on your CDC as well. So I put my CDC in on Pisces. I see that it's been approved. I'm ready to bill. Before I do that, I'm going to go out onto the Sooner Care Provider portal. I'm going to go into search authorization status. If I have the prior authorization number, I can put put that in the prior authorization number field. If not, I can put the member ID. I'm going to hit search. It's going to come back and we see that we have our prior authorization. And we see our dates here, but what we're going to do, this is a blue hyperlink. We're going to click on that hyperlink. And the main thing I want to point out here is, remember we talked about the dates. The dates are based on what you put in when you submit the CDC. So we're looking at an authorization that has been approved on the provider portal for an agency. So this one is approved from the 25th of October to the 24th of November. And we see that we have our bucket of money. Then we have another level or another row that starts on the 25th of November and goes to the 24th of December and so on. So we have our 6 months. So it's so important that you know what the dates are on your prior authorization, and you also it will tell you how much money you have in that bucket of money so that you can utilize that money that was allotted for that member. Now then, we're going to look at an authorization. This is for an individual LBHP or a group. And when you put in your 23 CDC, that gets you 4 visits per month for 6 months. So once again, our dates are based on what was put on the CDC when we put it into Pisces. So we see 2/12 to 3/11, 3/12 to 4/11. And you get 4 visits a month, and this lets you know how many visits you've used for the month. So our example here, we had 4, we billed 2, and we see that we have 4 on all the rest of them. So that is so important that you know, just because that prior authorization is approved in Pisces, it has to be rolled over to the OHCA website. And once in a blue moon, one may fail to roll over. All you have to do is reach out to DMH and say, hey, my Pisces has been approved my CDC has been approved in Pisces, but it's not showing on the provider portal. They can resend that file for you. So now we're going to jump into the most important part. We're going to talk about how do you bill and get paid. So we're going to go up on the provider portal. We're going to go to claims and we're going to choose submit professional. And the information up at the very top will all be filled in for you. It will be the provider that you are logged in under. So we're going to go through the very basics that are required. So we're going to put the member ID in the member ID field. Number one thing I can tell you on our provider portal, that tab is your friend. I type the member ID in, I hit tab, and it's going to fill in the member ID, the name, and all that information. Our example, this member has no other issues with other insurance, so we're going to go down to the bottom. We're going to hit continue. We're going to go to step 2 on our claim. We require at minimum 1 diagnosis code. You can have multiple. And the other thing when you're putting diagnosis codes in on our provider portal is we do not like decimal points. So if you know that this diagnosis is F41.1, you put that in, it says it's invalid. Our website does not read the fields where the decimal is. So take the decimal out, put F4111, it comes up, you can add it. You can add multiple diagnosis, but in our example today, we're only putting 1 in. We've added it to the claim, and we're going to hit continue. Now we're to step 3. This is where we're putting all the information in, and there's a lot of information here for you to put in. The from and to date of service. The only time you would ever use a span date is if you were seeing a member 3 days in a row and you put the first date through the last date. But the chances are that you're seeing them one day a week. So you're going to put, for example, we'd put 6/24/20 to 6/24/20. Place of service, that could be office, home, other, several places. You can drop down and choose. Procedure code, that is going to be the code that you are billing. If you're billing as an individual LBHP, most likely it's going to be like a 90891, 90837. Agencies bill codes like the H0004. Modifiers. Agencies do use modifiers. And if you're using something like a TF or something, HE, HF, TF, that's where that would go. Also, if you are billing telehealth, which most of you are right now, this is where your GT modifier is going to go. You can have up to 4 modifiers on a claim. So if I'm billing an HE, and a GT. I'm going to put one 2-digit code in the first box. I'm going to tab over and put the second set in the second box. Diagnosis pointers are probably the hardest thing for providers to understand. What I'm saying is that if I hit that drop down, if I only put one diagnosis code on step 2, there's going to be a 1 there. And basically what I'm saying is I'm saying this procedure code that I'm putting on this line of service refers back to which diagnosis code on step 2. If I only put one, there's only a 1, you're going to choose 1. Then you're going to put your charge amount. We recommend that you bill your usual and customary, because if you bill us less than the Sooner Care allowable, we're going to pay you less. Then you're going to bill units. If you bill for an agency, you usually bill in 15-minute increments, so you're going to need to know how many units, and you're going to do the math if there is more than one unit. So if one unit is $15 and you're billing 3 units, you need to make sure that you're billing us $45. If you're billing for a behavioral health group or an individual, you're going to bill 1 unit and make sure you bill us your usual and customary. The DMH contract source, that is only for DMH contracted providers, so you should know what you're doing there when you put that in. That's going to be your little 4-digit contract source code. The rendering provider ID, this is going to be the individual number of the provider who rendered service to that member. So it's going to be their MPI number. We're going to tab over to ID type. The only option is MPI. Zip code, this is very important, especially if your rendering provider is tied to more than one group. We need to have the zip +4 that is tied to your group. And then once again, if you're a DMH contracted provider, you will use the contract code field. That is all you need to do on here. Then you're going to hit add. If for some reason you have a second line of service or you're billing 2 different lines of service, dates of service, you can go to the second line and submit it. If you're done, you're going to hit submit. It's going to come back. It's going to let you look at it. And if everything is good with it, you're going to hit confirm. Your claim should come back usually within 10 to 12 seconds, and it's going to tell you if it paid, if it denied, or it suspended. And I will tell you that if you're not sure, all claims in a paid status by noon on Wednesday process and pay the following week. So if you bill us weekly, we are going to pay you weekly. So that's how easy it is to submit a claim. And when I was working on this, I did this class a couple of times. I was going through things and I saw all these acronyms and I'm like, my goodness, what do all these things mean? So I figured you, the provider, would like to know too. So this is a handy little tool, lets you know what all the different acronyms that are used, what they mean. Like I said, we're not going to leave you without any resources. So there are the phone numbers you can call in to get help. There's information to reach out to DMH for help on the Pisces. If you're needing some training, we have access. You can send an email in and request training through the Sooner Care Education. And then here are ways just to get in touch with the Oklahoma Healthcare Authority if you have any questions. Thank you for attending today's class.